Hello, I'm Erin Kopp, a nurse practitioner at a National Cancer Institute designated comprehensive cancer center.
And I'm Karen Huelsman, an infusion nurse with Erin at the same center. We will be discussing how to prepare and administer POTELIGEO, mogamulizumab injection for the use in treatment of mycosis fungoides or Sézary syndrome.
POTELIGEO is indicated for the treatment of adult patients with relapsed or refractory mycosis fungoides MF or Sézary syndrome SS after at least one prior systemic therapy. MF and SS are subtypes of cutaneous T-cell lymphoma or CTCL and are relatively rare.
In this video, we will discuss what can be expected during treatment and the importance of communication between the infusion nurse and the rest of the care team. We will be discussing pre-treatment patient counseling, dosing, monitoring of adverse reactions that may require dose modifications, preparation of the infusion, infusion administration, and important safety information.
When a patient begins treatment with POTELIGEO, it may be helpful to review the POTELIGEO guide to scheduling and monitoring treatment with the patient.
This lets patients know what to expect during treatment and the infusion process and encourages them to share with you any side effects, symptoms, or improvements they experience while on POTELIGEO. Reviewing the guide with the patient may also help patients to set up and plan their infusion schedule and record important information about their scheduled infusions.
If the patient is not already familiar with Kyowa Kirin Cares, they may want to learn about the program, which provides information and support to patients throughout their POTELIGEO treatment. Features include reimbursement support services, a copay program for eligible patients, and access to an oncology nurse specialist. POTELIGEO is indicated for the treatment of adult patients with relapsed or refractory mycosis fungoides or Sézary syndrome after at least one prior systemic therapy. The recommended dose of POTELIGEO is 1 milligram per kilogram of the patient's weight. The dose does not need to be adjusted for older patients or patients who have renal impairment or mild to moderate hepatic impairment. No clinically significant changes in the pharmacokinetics of POTELIGEO have been observed among these populations.
POTELIGEO is administered as an intravenous infusion over at least 1 hour. Never administer POTELIGEO subcutaneously nor by rapid intravenous administration. POTELIGEO is administered weekly for the first 5 infusions and once every 2 weeks thereafter. In other words, in the first 28-day cycle, POTELIGEO is administered on days 1, 8, 15, and 22. Then POTELIGEO is administered on days 1 and 15 of each subsequent 28-day cycle starting at day 29.
With POTELIGEO, there is no predetermined number of cycles as you may be used to with some other infusion treatments, so patients may be treated until disease progression or unacceptable toxicity occurs.
For example, in MAVERICK, the phase 3 clinical trial that was the basis of FDA approval, the median treatment exposure was 5.6 months for patients treated with POTELIGEO. 48% of patients were treated for at least 6 months and 23% were treated for at least 12 months. The range of treatment exposure was from less than 1 month up to 45 months.
The package insert describes potential adverse reactions that may warrant dosing modification: infusion reaction, drug eruption, a type of rash, and autoimmune complications. More information about these AEs is contained in the Warnings and Precautions section of the prescribing information. Monitoring for these and other potential adverse reactions is important.
Patients must be monitored for infusion reactions. Infusion reactions are the most common adverse reactions seen with POTELIGEO, and they can be serious. During the MAVERICK trial, 35% of patients experienced an infusion reaction and 3% of patients experienced an infusion reaction that was severe, grade 3 or higher. The most commonly reported signs of an infusion reaction include chills, nausea, fever, tachycardia, rigors, headache, and vomiting.
It is important to note that although 90% of infusion reactions occur during or shortly after the patient's first infusion, they can also occur with subsequent infusions. The prescribing information recommends pre-medicating prior to first POTELIGEO infusion with diphenhydramine and acetaminophen.
For a mild to severe infusion reaction, temporarily interrupt infusion and treat symptoms following your institution's protocol. When restarting the infusion after symptoms resolve, the prescribing information states that the infusion rate should be slowed by at least 50%. If a reaction occurs and is unmanageable, discontinue the infusion. If a patient has had an infusion reaction to POTELIGEO, the prescribing information states that diphenhydramine and acetaminophen should be administered prior to a subsequent infusion.
Throughout the course of treatment with POTELIGEO, the patient should be monitored for rash, including drug eruption. During the MAVERICK trial, 25% of drug eruptions occurred after 31 weeks, and median time to onset was 15 weeks. A baseline assessment of the patient's skin can provide for a comparison during subsequent visits. Then, before each infusion, note the presentation of rash and its body surface area. Macules, papules covering greater than 30% BSA with or without associated symptoms is a grade 3 rash.
25% of patients experienced a drug eruption and 4% experienced a reaction that was grade 3 or higher. The majority were grade 2 or lower.
Another important thing to know about drug eruption is that it can look a lot like disease progression in the skin.
So how will I be able to tell the difference?
The only way to accurately distinguish drug eruption from disease progression is skin biopsy. Inform the patient's attending physician or nurse practitioner, and we can make the determination whether a skin biopsy is required. The prescribing information recommends temporarily interrupting treatment and administering at least 2 weeks of topical steroids. If with topical steroids the rash improves to grade 1 or less, resume POTELIGEO. Of course, POTELIGEO should be permanently discontinued for a life-threatening grade 4 rash, any Stevens-Johnson syndrome, SJS, or toxic epidermal necrolysis, TEN. Signs of SJS and TEN include fever, painful skin rash, and blisters. These symptoms should be reported to the physician or nurse practitioner. If SJS or TEN is suspected, stop POTELIGEO and do not resume unless SJS or TEN has been excluded and the cutaneous reaction has been resolved to grade 1 or less.
In the case of suspected immune-mediated adverse reactions, POTELIGEO should be interrupted or permanently discontinued as appropriate. In the MAVERICK trial, 2% of patients required systemic immunosuppressants for immune-mediated reactions. Grade 1 or 2 new onset hypothyroidism occurred in 1% of patients. Grade 3 or higher immune-mediated or possibly immune-mediated reactions reported with POTELIGEO include myositis, which may present as muscle pain or soreness, myocarditis, the symptoms of which include chest pain, arrhythmias, and shortness of breath, polymyositis, which is associated with muscle weakness, particularly in the hips, thighs, shoulders, upper arms, and neck, hepatitis, which may include symptoms such as fatigue, abdominal discomfort, and joint pain, pneumonitis, which is noted by shortness of breath, and a variant of Guillain-Barré syndrome, the first symptom of which is usually weakness and tingling in the extremities. If you see any of these reactions, immediately report them to the attending physician.
The most common adverse reactions reported with POTELIGEO are rash, including drug eruption, infusion-related reactions, fatigue, diarrhea, musculoskeletal pain, and upper respiratory tract infection. For a complete list of adverse reactions, see the Practical Use Guide or the full prescribing information.
Before each infusion, gather the supplies you will need, such as a primary infusion set with a 0.22 micron or equivalent inline filter, an IV bag of 0.9% sodium chloride, a safety IV catheter, 22 or 24 gauge by 1 inch maximum length, antiseptic swab, gauze, medical tape, a non-latex tourniquet, and gloves. Check the patient's vital signs and weight. Inform the attending of any significant weight changes, and assess the patient's skin for signs of rash or worsening of existing rash. Ask if the patient has any new symptoms or medications since the last visit. Be sure to review the important safety information with the patient and answer any questions they may have. If the patient has brought the POTELIGEO guide to scheduling and monitoring treatment with them, Take the opportunity to review any notes the patients may have made.
Depending on your institution, you may or may not have to calculate the patient dose of POTELIGEO. POTELIGEO dosing is 1 milligram per kilogram of the patient's body weight. As an example, a patient weighing 150 pounds has a body weight of 68 kilograms. Such a patient would need 68 milligrams of POTELIGEO. As POTELIGEO comes 20 milligrams per vial at a concentration of 4 milligrams per milliliter, a patient weighing 68 kilograms would need 4 vials, from which you would use 3 full vials to get 60 milligrams of POTELIGEO and 2 milliliters from the 4th vial to get an additional 8 milligrams of POTELIGEO. If you want more information on dosing calculations, click on the link to download the POTELIGEO Practical Use Guide.
Now, we will review how to prepare and administer POTELIGEO. First, visually inspect the drug product solution for particulate matter and discoloration prior to administration. POTELIGEO is a clear to slightly opalescent, colorless solution. Do not use the vial if you observe cloudiness, discoloration, or particulates. Aseptically withdraw the required volume of POTELIGEO into the syringe and transfer it into an IV bag containing 0.9% sodium chloride. The final concentration of the diluted solution should be between 0.1 milligrams per milliliter and 3 milligrams per milliliter. Mix the diluted solution by gentle inversion. Do not shake. The POTELIGEO solution should be infused immediately or stored under refrigeration at 36 to 46 degrees Fahrenheit or 2 to 8 degrees Celsius for no more than 24 hours from the time of infusion preparation. Do not freeze, and again, do not shake. Discard any unused portion left in the vial.
If this is the patient's first infusion, premedication with diphenhydramine and acetaminophen is recommended in the POTELIGEO prescribing information.
Administer infusion solution over at least 1 hour through an intravenous line containing a sterile, low-protein binding, 0.22 micron or equivalent inline filter. Do not mix POTELIGEO with other drugs, and do not co-administer other drugs through the same intravenous line. In the clinical trial, subjects were observed closely for 1 hour following each administration of POTELIGEO.
Thank you for joining us. We hope that this portion of the video has been helpful. Please listen to and view the next portion of the video, which is the important safety information. Also, for more information, visit www.poteligeohcp.com.
Indication: POTELIGEO mogamulizumab-kpkc injection for intravenous infusion is indicated for the treatment of adult patients with relapsed or refractory mycosis fungoides, MF, or Sézary syndrome, SS, after at least 1 prior systemic therapy. Important safety information, warnings and precautions. Dermatologic toxicity. Monitor patients for rash throughout the course of treatment. For patients who experienced dermatologic toxicity in Trial 1, the median time to onset was 15 weeks, with 25% of cases occurring after 31 weeks. Interrupt POTELIGEO for moderate or severe rash, grades 2 or 3. Permanently discontinue POTELIGEO for life-threatening grade 4 rash or for any Stevens-Johnson syndrome SJS or toxic epidermal necrolysis. 10. Infusion reactions. Most infusion reactions occur during or shortly after the first infusion. Infusion reactions can also occur with subsequent infusions. Monitor patients closely for signs and symptoms of infusion reactions and interrupt the infusion for any grade reaction and treat promptly. Permanently discontinue POTELIGEO for any life-threatening grade 4 infusion reaction. Infections. Monitor patients for signs and symptoms of infection and treat promptly. Autoimmune complications. Interrupt or permanently discontinue POTELIGEO as appropriate for suspected immune-mediated adverse reactions. Consider the benefit-risk of POTELIGEO in patients with a history of autoimmune disease. Complications of allogeneic HSCT after POTELIGEO. Increased risk of transplant complications have been reported in patients who received allogeneic HSCT after POTELIGEO. Follow patients closely for early evidence of transplant-related complications. Adverse reactions. The most common adverse reactions reported in greater than or equal to 10% of patients with POTELIGEO in the clinical trial were rash, including drug eruption, 35%, infusion reaction, 33%, fatigue, 31%, diarrhea, 28%, drug eruption, 24%, upper respiratory tract infection, 22%, musculoskeletal pain, 22%, skin infection, 19%, pyrexia, 17%, edema, 16%, nausea, 16%, headache, 14%, thrombocytopenia, 14%, constipation, 13%, anemia, 12%, mucositis, 12%, cough, 11%, and hypertension, 10%. You are encouraged to report suspected adverse reactions to Kyowa Kirin Incorporated at 1-844-768-3544 or FDA at 1-800-FDA-1088 or fda.gov/medwatch. To learn more about POTELIGEO, visit poteligiohcp.com.